Hello. Hospitals. Letter A. Introduction to a hospital. Jordi Pons is a fourth-year medical student from Barcelona. He has come to Britain on an elective attachment to the Royal Infirmary, Edinburgh. Dr. Barron is introduced him to the hospital. Dr. Barron. The Royal Infirmary is the name of the University Hospital for Edinburgh University. It is a general hospital dealing with all types of patients and illness, except pediatrics. We have a specialist hospital for that in another part of Edinburgh, the Hospital for Sick Children. You can see some of the departments in your hospital on the sign. Of course, there are many others, for example, the Intensive Care Unit, ICU, and the Surgical High Dependency Unit, AHDU. Jordi, what does outpatients mean? Dr. Barron, outpatients are the people who come to hospital to attend a clinic or to have tests on treatment and then return home on the same day. Inpatients stay in the hospital for 1 or more days. The rooms where they stay are called wards. If a patient's treatment requires only 1 day, such as a simple operation, they can be admitted to the day surgery unit. Welcome to the Royal Infirmary. South entrance. Car park C and D, visitors and staff. The Simpson Center for reproductive health. Gynecology, emergency, maternity emergency, neonatology emergency, outpatients departments, all wards, day surgery unit and endoscopy, X-ray department, combined assessment. Letter B, outpatients. Dr. Barron. The accident and emergency department, A and E, also called casualty, is where patients who are actually ill with a sudden serious condition come for assessment and treatment. Outpatients who have an appointment to see a specialist go to a clinic in on the outpatients departments, OPDS. They have usually been referred to the hospital by their their GP, who writes a referral letter to the consultant explaining the patient's problem. Letter C, inpatients. Dr. Baron. Dr. Baron, the inpatients in a hospital are admitted in one of three main ways. They may be sent in one of the outpatient clinics and admitted from there, or if there is a lot of demand for the treatment they need, as in the case of a hip replacement, they are put on a waiting list for admissions. Alternatively, their GP may arrange the admission by telephone because they are actually ill. For example, with suspect myocardial infarction, or they are seen in the A&E department, where the doctor on duty working at that time arrange the admissions. This will happen in the case of a patient with a fractured neck of femur. For example, larger hospitals may have an assessment unit where patient can be admitted temporarily while their conditioning assessment. Georgie, assessment. Dr. Barham. Yes, decisions are made about their conditions and what it needs to be done to help them. After treatment is completed, the patient is discharged back to the GPS care. Exercise 9.1. Complete the table with words from A, B, and C opposite. Put a street mark in front of the stressed signable in each word. The first one have been done for you. Verb, admit. No, admission. Verb, assess. No, assessment. Verb, discharge. No, discharge. Verb, operate. No, operation. Verb, refer. No, referral. Verb, treat. No, treatment. Exercise 9.2. Make words combination, use a word from each box. Look at the opposite to help you. Actually ill. Assessment unit. One, duty. Referral letter. Rating list. Exercise 9.3. Which hospital departments will be most appropriate for the following patients? Look at A, B, and C opposite to help you. 1. Woman in diabetic coma. Intensive care unit. ICU. 2. A patient who has a radical protectomy, prostatectomy, high dependency unit, HDU. 3. A patient who is to have a skin lesion removed, day surgery unit. A man with a foreign body in his eye, gynecology emergency. 5. A woman with a threatened abortion, accident, and emergency, A&E. Complete exercise 9.4. Complete the extract from an information left there for patients. Look at A, B, and C opposite to help you. Information patients. Information for outpatients. When you arrive at the hospital, please tell the receptionist who will welcome you, test your details, and direct you to the reading area. The length of your visit will depend on the treatment you're going to have. You may need to have some tests, such as an X-ray, which could mean going to another department, or you may be referred to other professionals, such as a physiotherapist or dietitian. You may need to revisit the clinic if staff at the clinic want to see you again. Another appointment will be arranged for you. If you need to be admitted to hospital for more treatment, either as an inpatient or for day surgery, you will be told this is likely to happen. If you do not need further treatment, you will be discharged to UGPS care. Thank you.